Hey everybody, welcome to another episode of
Hi, friends.
Dual Wellness, the show where a mother who is 56 and her son who is 23 named Camille and Max, I'm not Camille, that's Camille, I'm Max, talk about health, wellness, physical, mental, financial, all that kind of stuff. Any topics we feel like talking about, and our opinions on it. It's not fact, anything like that, it's just our opinions. So
It's just us.
Mother!
What? Oh my word.
What are we talking about?
Okay, what we're talking about today.
Oh yeah, wait a second. Please like, comment, subscribe. Thank you very much.
So, what we're going to talk about today, Max and I have a tendency to talk about lighter topics for the most part, but this is a semi-not light topic.
Yeah.
In that it deals with mental health and some assistance that you can get.
Mental wellness.
Mental wellness, yep. So one of the types of therapies I've always been really super open about how therapy. I'm very pro therapy, and that's how Max was raised, and that's how we practice what we preach. So one of the forms of therapy that has helped me tremendously, that has helped me deal with some different things that have happened. And when I say deal with it has helped me process things that have happened. This form of therapy is called EMDR. And I'm going to pull up I have my phone because the EMDR acronym it's eye movement desensitization and reprocessing. So that's what it stands for. And what it is, it's a protocol. It's an interactive psychotherapy technique. And there are, what do they call them, levels or stages? So the reason we wanted to talk about it is because I went through the whole entire process about 4 years ago now, and helped tremendously. And Max has just started going through the process. So, excuse me, there are different levels, or I'm not sure how stages that they call it. So the way my therapist explained it to me was that you have the different stages of the protocol. And so, say for example, I was taking EMDR, or I was having EMDR in Michigan, and for whatever reason, I had to go to Texas. As long as I found a licensed therapist that was trained in EMDR, they would be able to begin exactly where I had left off. So that's the nice thing about this protocol. And what it is it's a form of therapy where you talk about it is kind of talk therapy, but you talk about whatever the event is that you need help with processing that is triggering you or whatever. And while talking about certain things with it, there's a couple of different ways you can do it. Some therapists do it with a finger. It is a bilateral eye movement. So some therapists do it with a finger. Some therapists do it with a light bar where you're following a light. Some therapists do it with headphones where you close your eyes, you're speaking, and you have sounds that are coming. And what it does, what the theory is, and the way my therapist explained it to, I'm going to just talk a little bit more and then let Max talk a minute because I'm talking a lot. But how my therapist explained it to me, she said, when events happen in our lives that are big, traumatic, life-altering, huge events happen in our life. What happens with our brain is like a filing system, and these events get stuck. It's like our brain gets stuck. It does not know what file to put these events into. And so your brain keeps going over it, and it either through nightmares or triggering events or different ways that your brain can do that. Well, what EMDR does is it is kind of based on REM sleep and how your body processes that how your brain processes information while you're in the middle of REM sleep. So EMDR helps your brain find the file that event goes into. So that's what I know about EMDR. So what, you don't have to speak specifically about events or anything like that, but what made you seek out?
Yeah, exactly that kind of stuff. I feel like, one, I have really bad nightmares all the time. I have a hard time sleeping and slowing my brain down in general.
Anxiety.
I get some anxiety here and there. I wouldn't say I have like crippling anxiety or anything, or my anxiety is really the main thing that's really bad. Yeah, it's more so just it just feels like I have a queue in my brain that hasn't been it feels like it has layers and layers and layers of thoughts that I need to get through before I can be in this moment currently. And that's the intention behind it, is I keep going back to the past and when I would like to be here right now. And it's very difficult to do that when past is so large and so prominent, and you don't really have the tools to figure out what you need to learn from those moments. So having somebody else who is a professional and like picking those things out and helping you understand them and moving through them in a safe environment, you're creating a safe environment where you know that if you delve into that, it's not just going to make you more focused on it and go a little
freak out,
cuckoo.
No.
Yeah, so that's the reason I wanted to do it. Yeah, I've had some pretty wacky experiences in my past, so I would like to, I guess, figure those out and see what's, get out of the loop, break myself out of a loop, because sometimes I think everybody can relate. You find yourself regressing, going back to old things, going back to old securities or something like that constantly, and that doesn't feel good. It feels like you can't move forward. So yeah, really the intention is just to help myself move forward, before I get really deep into the spiral.
Yeah, yep.
So, and I think maybe, like when I first heard about it, like, oh, you're just following their finger. And blah,
it
blah,
sounds
blah, blah.
hokey, doesn't it?
It sounds hokey, or you're like, oh, it's hypnotization, blah, 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 blah. But just like with hypnotization and stuff, people who say it says it works, it's because they are seeking the help and the things that they can learn from hypnotization. They're having an open mind towards it. What I'm doing right now is I'm creating an ID for myself as to this is how I can work through these things. It's more so my mindset and the intention behind wanting to work through these things in a safe way that I think,
safe and guided way.
Yeah, that I think is where the help, where the real benefits of it truly come in, is because I am attempting.
You're seeking it out.
Yeah, exactly.
Yep.
So I think it's really helpful. I think it's pretty cool. I'm excited to do it. I haven't actually done any of it quite yet. I've just gone to 2 sessions and my therapist has kind of explained it. And
in the first couple of sessions, you are just, for want of a better word, setting the stage.
Yep.
You're setting the stage. You're discussing the different events and stuff like that, and then
exactly.
Probably with the next one, I think you'll start getting into the nitty gritty.
I personally think with yeah, and it's not a permanent thing. Once you're done, and then you move on, and then it's like, okay, see ya. If you need, it's not like you have 6 months, get out of here. When you're done, when you feel like you've achieved the goals that you're looking for, because that's another thing my therapist did, is wrote down goals that he'd like to accomplish, so he knows that we are making progress.
Yeah.
Once that is done and you've achieved all those goals, then I think it's like, okay, if I would like to, then I can move on to a talk therapist, because I personally feel like if I went to a talk therapist right now and I just kept talking about these problems, then I would still just be in the loop of the issue.
Yeah.
So
that makes sense.
Yep.
That makes sense. And one of the things so I've done some research with EMDR is that you don't only have to utilize EMDR if you've had, giant traumas or anything. If you have, I definitely recommend it for that. But you can have what they call tiny traumas and small traumas and stuff like that. I mean, it's or if you feel like you are
in a loop. It's not just traumas, it's
yeah.
patterns. It's
Yep.
When when this happens, I always go back to watching this TV show or doing this or I get into a rut and I decide to eat really poorly or something like that, right? Or I stuff just in general.
Sometimes when we are in that loop, one of the things that we do is we choose self-destructive behavior, and it could be anywhere from what you eat, doing not safe things, whatever.
Good one, Mom.
I know. So that is so it can help with that stuff.
Yeah, just patterns, analyzing patterns, breaking out of them, so you can make new ones,
and making it so your brain goes, okay, that's where it goes. Let's move on.
Yep. Just like you should move on to the like button and the subscribe.
That was a good segue.
and to hit subscribing and to the other videos in our channel. So
you're a dork. All right. So anyway, don't say like, subscribe. Anyway, let us know if you have any questions. You want to send a message to me. We're on Instagram, whatever. I'm the one that would be responding. That we're under Dual Wellness 2022. So if you want to make a comment, yay, please do. We obviously are open books. So and like Max said, like, comment, subscribe. All right.
I actually just choked on my spit. Thanks, everybody. Thanks for watching, and we'll see you in the next one.
Bye, friends.
Have a great day. Yeah.